Hey everyone, welcome back to the channel. My name is Aryan Malik and this is Chari with me on my NCLEX journey. In the previous video, we went over the signs and symptoms of acid-base imbalance and how to interpret whether it's metabolic acidosis, alkalosis, or respiratory alkalosis or acidosis. In this video, we'll be going over the causation. So how does NCLEX test on the causes of acid imbalance? Let's first understand the principle of it. So, before answering the question, we should ask ourselves, is the question about lung? If yes, then it is respiratory. And then one should ask oneself that are they overventilating or underventilating? If the patient is overventilating or underventilating, and if the patient is overventilating, then one should pick alkalosis, and if underventilating, then we should pick acidosis. Now let's break this principle and understand in a more deeper terms. So what do I mean with overventilation? So ventilation, it translates to respiratory because that's what the respiratory system does. Over, so one knows that alkalosis is over the normal because the pH is high. So whenever it is overventilation, we know that the patient is in respiratory alkalosis. And when the patient is in underventilation, so we know when the pH is low, it is acidosis, and ventilation again is respiratory. So when we join those words, it becomes respiratory acidosis. Now let's understand this with some scenarios. So say a woman is overzealously using her breathing technique during labor. What acid-base disorder will she exhibit? Now first look at the key terms. Overzealously. So we know it's overventilation, and breathing, meaning it is lung. So we know that whenever it's over, it's alkalosis, and breathing is one of the functions which is by lung. So respiratory alkalosis. The next scenario is a child who was a victim of near drowning. What acid-base disorder would it be? Now, when a person drowns, or when the patient, the child in this case, is drowning, they're experiencing underventilation because the air sacs are shutting down. So the patient is underventilating, and we know it is under is acidosis, ventilating is respiratory. So it will be respiratory acidosis. Next scenario is patient has emphysema. So emphysema is a lung problem in which the air sacs of the lungs are damaged and they become enlarged, causing breathlessness, or the patient is not able to breathe properly. So this will be a case of underventilation, and we know under is acidosis, low pH, acid, and ventilation, lung, respiratory. So it will be respiratory acidosis. Now, one thing which I myself was confused and had to figure out by doing more and more questions is that breathing pattern or respiratory rate is something that I should not depend on while answering these questions. And let me explain why. Ventilation has to do with gas exchange and not respiratory. So say a person had pneumonia in the four lobes of the lungs, and they are breathing at 50 a minute, and their SpO2 is 78 on 8 liter per mask. So now again let's look at the key terms. They have pneumonia, four lobes of the lungs, again the lung problem, and breathing at 50. Now we know that the breathing, normal breathing is 12 to 16 per minute, or normal respiratory rate is 12 to 16 breaths per minute, and their SpO2 is 78, while for pneumonia I think it should be more than 90. Don't quote me on this, I could be wrong. So what we gather is the patient is underventilating even though their respiratory rate is high, even though their RR is 50, they are underventilating because they have the pneumonia of the lungs, and their SpO2 is low. So the only lab that one should focus on while answering the causation problem of acid-base imbalance is of SpO2. So SpO2 is good, breathing is slow, then the patient is absolutely fine. They are facing no problems. If SpO2 is low, they're breathing fast, which means underventilating. So when we get acid base disorder questions, the piece of the data, as I said, that really is important is SpO2, because a lot of times the respiratory rate is just a compensatory method, which means it is the total opposite. If we choose it, we are just going in the opposite direction of what we actually intend to do and answer the question. So long story short, we should only pay attention to the SpO2. Now the next scenario is, say someone is on a PCA pump. What acid imbalance will tell us as registered nurse that maybe they need to come off that? So as we all know, PCA pump, it's given for usually for patients after surgery for pain, and it depresses the respiration. So if the patient is getting too much of the PCA pump, it will depress the respiratory system even more, and the ventilation will go down. So person will be underventilating, which would mean that they are going towards respiratory acidosis. Under acidosis, ventilation, respiratory. I hope this video helped. Please stay tuned as more videos in the series will be coming out. The next video comes out tomorrow. If you like this video, please make sure to share it and also subscribe to the channel. Thank you.